Yellow Fever, Things You Should Know, Questions and Answers, by Rumi Michael Lee. I would like to thank and congratulate you for listening to this book, Yellow Fever, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of yellow fever. Chapter 1. 1. Is yellow fever caused by a virus? Yes, yellow fever is caused by a virus. 2. What virus causes yellow fever? The virus that causes yellow fever is the flavivirus. 3. Can yellow fever spread between people? No, yellow fever cannot spread between people. 4. Is yellow fever an acute disease? Yes, yellow fever is an acute disease. 5. What is an acute disease? An acute disease is a disease that appears rapidly and lasts for a short time. 6. Is yellow fever a systemic disease? Yes, yellow fever is a systemic disease. 7. What is a systemic disease? A systemic disease is a disease that affects the whole body. 8. How does yellow fever spread? Yellow fever spreads through an infected mosquito bite. 9. What kind of mosquito spreads yellow fever? The Aedes aegypti mosquito spreads yellow fever. 10. What is the main risk factor for yellow fever? The main risk factor for yellow fever is traveling to certain countries. Chapter 2. 1. What are the signs and symptoms of yellow fever? The signs and symptoms of yellow fever are fatigue, headaches, backache, muscle ache, fever, chills, nausea, vomiting, weakness, a loss of appetite, etc. 2. Can you have yellow fever without symptoms? Yes, you can have yellow fever without symptoms. 3. What is the cure for yellow fever? There is no cure for yellow fever. 4. Can yellow fever cause complications? Yes, yellow fever can cause complications. 5. Can yellow fever cause shock? Yes, yellow fever can cause shock. 6. What is a shock? A shock is a life-threatening condition due to severe insufficient blood flow. 7. Can yellow fever cause liver disease? Yes, yellow fever can cause liver disease. 8. Can yellow fever cause jaundice? Yes, yellow fever can cause jaundice. 9. What is jaundice? Jaundice is the yellowing of the skin, the sclera, and the mucous membranes due to the accumulation of bilirubin in the blood. 10. Can yellow fever cause bleeding? Yes, yellow fever can cause bleeding. Chapter 3. 1. Can yellow fever cause vomiting of blood? Yes, yellow fever can cause vomiting of blood. 2. Can yellow fever cause blood in feces? Yes, yellow fever can cause blood in feces. 3. Can yellow fever cause heart problems? Yes, yellow fever can cause heart problems. 4. Can yellow fever cause sensitivity to light? Yes, yellow fever can cause sensitivity to light. 5. Can yellow fever cause delirium? Yes, yellow fever can cause delirium. 6. Can yellow fever cause seizures? Yes, yellow fever can cause seizures. 7. What are seizures? Seizures are electrical uncontrolled disturbance in the brain. 8. Can yellow fever lead to coma? Yes, yellow fever can lead to coma. 9. Can yellow fever cause bradycardia? Yes, yellow fever can cause bradycardia. 10. What is bradycardia? Bradycardia is a slow heart rate. Chapter 4. 1. Can yellow fever cause albuminuria? Yes, yellow fever can cause albuminuria. 2. What is albuminuria? Albuminuria is the presence of excess albumin in urine. 3. Can yellow fever cause arrhythmias? Yes, yellow fever can cause arrhythmias. 4. What are arrhythmias? Arrhythmias are irregular heartbeats. 5. Can yellow fever be prevented? Yes, yellow fever can be prevented. 6. What is the incubation period? The incubation period is the time between the moment of infection and the signs and symptoms of the infection. 7. How can yellow fever be prevented? Yellow fever can be prevented by using insect repellent, getting vaccinated before traveling to countries at risk of yellow fever, covering the body with long-sleeved shirts and trousers, mosquito nets, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding yellow fever.